Introduction to Medicine is a basic course introduced to students at the beginning of medical education. Its main objective is to provide a thorough understanding of the basic principles of medicine. An introduction to the human body and the theoretical basis underlying medical practice. This course is essential to provide a strong foundation for medical students to understand more complex medical concepts in subsequent semesters. The following is a more detailed explanation of Introduction to Medicine, covering the basic components, objectives, scope, and applications in medical education. 1. Objectives of Introduction to Medicine. The objectives of the Introduction to Medicine course are to introduce medical students to the basic aspects that form the framework of medical knowledge. These objectives include a. Providing a basic understanding of medicine. Students are introduced to the basics of medical science covering various branches and specializations. They learn about the history of medicine, principles of medical ethics, and health systems. B. Equipping students with knowledge of human anatomy and physiology. Students are introduced to the structure of the human body and the function of body organs and how the human body works as a whole. C. Developing an understanding of the role of physicians in society. Teaching students about the social and professional responsibilities of a physician in public health services and their important role in the prevention and treatment of disease. D. Introducing students to the principles of medical ethics, teaching students about the Code of Medical Ethics, including the basic principles that must be upheld by doctors in providing medical services. E. Building a strong foundation for further learning. Providing a strong foundation in various medical disciplines, which will be used to study more specific branches of medical science such as pathology, pharmacology, and clinical science. 2. Scope of Introduction to Medicine. The Introduction to Medicine course covers various topics that are important for understanding medicine as a whole. Some of the scopes that are usually taught in this course include a. History of medicine. Introduction to the development of the history of medicine from ancient to modern times. This learning includes important figures in the world of medicine, such as Hippocrates, Avicenna, to important discoveries in modern medicine. Example: Introduction to Hippocrates' Principles of Medical Ethics and their influence on the development of medical science. B. Health system. Understand the health system in the world and in Indonesia, including the health service system, organizational structure, and health policies that underlie medical care. Example: Introduction to primary, secondary, and tertiary health service systems, and the role of hospitals and other health facilities. C. Medical ethics. Introduction to the Code of Medical Ethics that governs the professional behavior of a physician. as well as basic principles such as beneficence, non-maleficence, autonomy, and justice. Example: teaching the importance of informed consent in medical practice. D. Basic anatomy and physiology. Introduces students to the structure of the human body, anatomy, and how organ systems function, physiology. This includes basic knowledge about the human body that will be the foundation for further learning about health and disease. Example: understanding the circulatory system, nervous system, and digestive system in humans. E. Basic biochemistry. Introduces students to the chemical components of the human body, including the structure and function of important molecules such as proteins, fats, carbohydrates, and nucleic acids. Example: introduction to basic metabolism and biochemical processes in the body. F. Basic microbiology and immunology. Introduction to microorganisms in the human body, as well as the immune system that protects the body from infection. This includes the basics of immunology, pathogenic microorganisms, and how the body responds to infection. Example: understanding the role of bacteria, viruses, and the immune system in maintaining health. 3. Basic skills acquired. After taking the Introduction to Medicine course, students are expected to be able to master the following basic skills. A. Ability to communicate with patients. Communication is an important skill in medicine. Students are trained to be able to communicate effectively with patients, understand their needs, and provide medical information in a clear and easy-to-understand manner. B. Clinical observation and evaluation skills. Although taught in more depth at the clinical education stage. Introduction to Medicine also teaches students to develop the ability to observe and evaluate important clinical signs in patients, such as blood pressure measurements and detection of disease symptoms. C. Ability to identify common medical conditions. Students are expected to be able to recognize signs of common diseases and understand the basics of diagnosis and treatment, which will be explained further in the following semester. D. Application of ethical principles in decision-making. Students also learn to understand and apply ethical principles in everyday medical decision-making, as well as consider social and cultural factors in caring for patients. 4. Teaching methods. The teaching methods in Introduction to Medicine vary widely, with a combination of theory and practice, including A. Lectures and discussions. Formal lectures are conducted to provide a basic understanding of medical theories. Group discussions are also an important part of deepening understanding of medical topics. B. Simulations and demonstrations. Interactive simulations and demonstrations of human anatomy with physical or virtual models, as well as the use of basic medical equipment. can help students understand medical concepts more practically. C. Case studies. Case studies are used to help students think critically about the application of medical knowledge in real clinical situations. In case studies, students will analyze patient symptoms and try to formulate a diagnosis and treatment plan. D. Direct practice. Direct practice under the supervision of lecturers or instructors, including introduction to medical equipment, basic procedures, and direct interaction with patients in hospitals or health facilities, will be conducted over time. 5. Challenges in introduction to medicine. Some of the challenges that students often face in this course include: A. Limited time to master the material. Medical science is very broad and developing rapidly, so it takes a lot of time and effort to master all the basic materials well. B. Difficulty in learning anatomy and physiology. Understanding the structure of the human body, organs, and the function of body systems in detail can be a challenge for some students. Therefore, this material often requires a lot of visual and practical exercises. C. Complexity of biochemistry and microbiology concepts. The science of biochemistry and microbiology that regulates processes in the human body may seem difficult to understand at first. Because this material is very technical and requires in-depth understanding. D. Integration of theory and practice. Combining the theory taught with practical applications in everyday life in a clinic or hospital can be challenging, especially when dealing directly with patients. 6. Conclusion. Introduction to Medicine is a very important basic course in medical education, which aims to provide a thorough understanding of the basic principles of medicine, human anatomy, medical ethics, and health systems. This course provides a solid foundation for medical students to learn more about medical science and practice clinical skills that will be used in their professional medical practice. With a good understanding of these basic topics, students can prepare themselves for more complex medical challenges in the future.